Hi, I'm Jason Jolson, and this is Jim Avery. We're with You Learn Online, and this is another EMS Talking Point. And the point today is crime scenes.
Yeah, welcome back, everybody. Let's talk about staging and crime scenes and what that could look like.
Yeah. We did quick little talking point there on staging. This one's about crime scenes and what should we avoid as EMS on a crime scene? Because a lot of the stuff that I've been looking up and trying to research, there isn't really. I haven't found anything out there that really explains what you should be doing on a crime scene.
Yeah. Well, we all know that you watch enough TV and stuff like that. There's evidence that we have to be careful of and stuff. And I think one of the big things with a potential crime scene is limit the number of people in there. The thing with EMS and stuff, we want to get in and we want to help and we want to do our job. But if we get too many people that doggy pile on a scene all at once, we're going to obliterate a lot of evidence for the police, and it makes their job harder and stuff. So really, we need to keep as minimum or minimize our footprint as much as possible.
Yeah, when you're talking about the footprint too, it's like even our work area where we have the patient, try to minimize the number of people like sit in that area, but also minimize that footprint of the area we're working in. So if you do need to move something, like say you gotta move a table or you gotta move a couch and you're gonna move it 2 feet, take note how far you moved it.
Mhm.
Because somebody probably is gonna come back and ask you the question, where was that couch?
Yeah,
Right.
and
And
and where possible, try to remember in a highly charged situation like that, especially if it's a particularly gruesome scene, then we don't always think we act. So we need to consider how we're acting and what we're doing as we do these things. Like you say, as we move a table or something, where did we move it from? If it's on a carpet, thankfully, usually there's a little imprint where it's
yeah.
generally stayed, but not always. So we have to be prepared to answer those questions as well as we can. I mean, our focus is still going to be patient assessment and treatment, but we do want to, you know, see justice served as much as possible.
Another thing too is like I point out too is like you said gruesome scene. I went on a scene where it was just full of blood the whole floor. But we had to be very careful not to walk through it. We had a student that stepped right through it. So I ended up in court. I had to explain to everybody whose footprints were whose. So when you're going into stuff like that, just be aware. And police want you to protect the scene as much as possible, but they also want you to take care of the patient.
Yes, they do.
And they're very good for that. So even if you do got to move some stuff, they usually take that into account. So if you can minimize the amount of work that they have to do afterwards to figure out where the table was, or like say there was just a pair of scissors you grabbed to move, and
Mhm.
sometimes we end up on these crime scenes before the police do because if it's like a domestic or even like say we got some drugs and stuff going on, people don't want to call the police because they don't want them involved. And then when you get there, you might have to move something or secure it.
Yep.
Now, that saying, if you come across a handgun or something that's going to really, be life threatening, you need to get out.
Yeah. Yeah.
Like this,
Your safety is always paramount.
yeah. So that's the biggest thing. And I think the biggest thing with the crime scenes is just minimize what you touch, minimize what you move, and just be cognizant that you're on a crime scene and be really careful where you put equipment.
Yep. And that includes even when you change gloves between patients, right? Where do you drop the gloves? And if you do drop some gloves on scene, then leave them there and tell the police that that was us, so that
Yeah.
they know and they can rule it out as a problem.
Yeah, and I guess one more thing to point out too is like when we were talking earlier about staging for those violent scenes, but when we do get the clear to come in, we also got to be aware of where we park our truck. Even at large accident scenes where they are going to coordinate off the area, and that kind of thing. And then next, your vehicle is actually in the crime scene, and I've seen it happen where you can't leave; they won't let you move your truck. Now you get another ambulance to come in to get the patient because now your truck has become part of the crime scene because they don't want you to mess up any tire tracks backing out. They don't want you going over it. So just be aware where you park and you think you're going to be able to get out as well. And I think that's about it for crime scenes because there isn't really much to say, like we said. And then at the end of the when you finish your PCR, jot down your own notes, what you remember about the crime scene, what happened, who was there, or that kind of stuff. So when you do go to court, you do have some notes to refer to
Yeah.
outside your basic PCR.
Yeah. Which has to be subpoenaed for you to see it. So
All right, so that's EMS Talking Points with You Learn Online, and that's Jim. I'm Jason, and we'll see you on the other side.